Hi everyone, thanks for listening to my presentations. Today I'll be talking about a familiar agent called biotin in multivitamins, but the effects of biotin on the heart. And someone is saying, no, is biotin causing heart attack? No, biotin is not causing heart attack. Is biotin causing thyroid hormone abnormalities? No, biotin is not causing hypothyroidism or hyperthyroidism. Then the question is, what is happening then? What effect is biotin having on heart attack and thyroid hormones? Okay, are you curious to know? Let's go. Yes, vitamins, thyroid gland, and heart attack. Vitamin A of biotin is found in dietary supplements and in multivitamins. Biotin could also be found in the following: multivitamins, B-complex vitamins, coenzyme R, prenatal vitamins, vitamin B supplements, vitamin H, dietary supplements for hair, skin, and nail growth. Okay, let me reiterate here again that biotin and B-complex or multivitamins are not bad, okay? They are not bad medications. Then you're going to ask me, why are you making this presentation then? Why are you scaring us that biotin, heart attack, thyroid hormones? Okay, get the fact. When someone has taken biotin or multivitamins or B-complex in the last 24 hours or anything less than 48 hours, that is less than 2 days, and there are signs and symptoms of heart attack or myocardial infarction, and the person presents or calls 911 and the individual arrives at emergency room and blood sample is taken to get some parameters from the lab to make the determination whether this is heart attack or myocardial infarction, and then administer appropriate medications or interventions. There could be a problem. Why? The biotin could lead to falsely low troponin. Doctors are familiar with that term. Falsely low troponins will give a clue that this is not heart attack. This is not myocardial infarction. Well, the truth is that this is heart attack, this is myocardial infarction, and this person is dying. You know what? The person will actually die. So, the presence of biotin in your blood, now having signs and symptoms of heart attack, not caused by biotin, but because laboratory investigation is pointing to another direction that this is not heart attack, that will lead to possible death. And of course, it will affect parathyroid hormone, thyroid stimulating hormone, affecting T4, T3, or could be affected either falsely increased or falsely low. What are we going to do then? I'll tell you in a bit. When it comes to thyroid gland, we are going to likely see falsely high T4, high T3, and low TSH. When the lab report is back and the doctor will see high T4, high T3, low TSH, the doctor will be thinking of hyperthyroidism, right? And the doctor will be calling for radioiodination, beta blockers to correct the peripheral effect like tremor and so on, then propyl uracil or methimazole. In someone who has no problem with the thyroid gland, or the doctor had made the diagnosis of hypothyroidism in this patient and already on levothyroxine for the treatment of hypothyroidism, but on getting to the lab after the patient had taken multivitamin B complex biotin for nail growth and so on, the value is back with high T4, high T3, low TSH. And the doctor said, oh, I have given too much levothyroxine, or oh, we are fine right now, Mr. So, Miss So, you don't need levothyroxine of 50 microgram that I place you on. So I'm going to bring it down now to 25 and still measure this value later on. Then it seems I've given you too much. And lo and behold, it's false. Why? Because of biotin. The plan is to avert this horrible, horrible state that could lead to death of many people. So I said plan and prevention. We have to ask about the history of biotin or multivitamin intake. Then, when that is the case, we will do two things. If we have already taken the laboratory sample, then the result coming from the lab should be cautiously interpreted. Or we can go ahead and assay for the level of biotin itself in the serum if we are suspicious that the affected individual is not furnishing us with correct info. If it is not an acute emergency, then with the history of biotin or multivitamins intake, we can delay the laboratory test till 2 days after the injection of biotin. Okay? Then we'll take more history, physical examination, and other investigatory tools if we are still confused about the whole situation. But if we're in a city or in a center that is well endowed with so many gadgets, with standardized laboratory equipment and manpower, we can go ahead to assay the biotin level itself in the serum. Here are some facts. Biotin is not a bad medication. Biotin in multivitamins or B complex is not bad. It's not dangerous to your heart. It's not hazardous to the thyroid gland or parathyroid gland. No. But it can mislead the doctor when you have taken biotin and multivitamins and you have to have the laboratory test to make the diagnosis of heart attack or hypothyroidism or hyperthyroidism or parathyroidism in any way. Multivitamins are available over the counter, like you know. The problem is not that they are not good, but the problem is about lab test under certain situations. For example, multivitamins taken, biotin taken 2 days, and then heart attack signs and symptoms and troponin level is assayed, is going to be low. False troponin level has led to a wrong diagnosis in the past, and it has actually led to death. Falsely increased T4 and T3 with decreased TSH can mislead the doctor to feel that we need decreased treatment of hypothyroidism. And of course, there will be consequences. You can check my channel for about 7 presentations on hypothyroidism. I'm not going to waste your time going into details here. Wrong diagnosis of hypothyroidism and possible treatment. Imagine giving all those medications to a wrong person. All these will have catastrophic effects. In conclusion, though I've said earlier that biotin and multivitamins will not be harmful to the heart and to the thyroid, but that is when it's taken moderately. When biotin is taken in excess, of course, there will be side effects affecting the gastrointestinal tract, the skin with rashes, the pancreas affecting the insulin release, and of course, kidneys. Well, I'll continue to push out pieces of info in medical field that will be very helpful to everyone. And I strongly believe that that will save more lives. In this case, biotin is not a bad medication, but letting your doctor know that you have taken biotin in the last 2 days or today, and now you need laboratory investigation as per ASTAC, hyperthyroidism or hypothyroidism or parathyroidism. That will help a lot, and it will afford the doctor the opportunity to cautiously interpret the laboratory investigations or actually postpone the laboratory investigation if you are not in acute need of such. Thanks for listening. Please remember to subscribe. Please remember to share. And I pray that more lives will be saved in medical world. Thank you.